So we are 1 week away from medical marijuana being legalized in South Dakota. Where does the state stand right now in implementing IM26?
Well, IM26 will be implemented on time as dictated by what the voters passed on the ballot last fall. It will become law on July 1st, and then the time frame that was laid out in that ballot measure stood up a lot of the program, the infrastructure, the software, the certifications by October 29th.
And where are those discussions on getting those implementations into place?
Well, we have 3 different agencies that are working on this, and also they have different time frames to do certain work as laid out by IM26 as it was passed by the voters. So the Department of Education has already put out their proposed rules. The Rules Review Committee by the legislatures looked at them, and they're still being worked on. And the rest of the guidance will be out for discussion and public input here within the next 24 hours or several weeks so that it can be implemented over the time frame that was laid out.
Okay. Now let's talk about July 1st. What happens? What does that mean, July 1st?
Well, on July 1st, IM26 becomes law. And essentially what that means is that the timeline starts for implementation of the program. Medical marijuana is legal then at the state of South Dakota, but the components that support that system are not fully implemented as dictated by IM26 until October 28th or 29th. So there's different time frames that the voters told us in how to do this. The vendor programs, the certifications, all that will be by the end of October, but the cards, the deadline for issuing those is not until November 18th. So it'll be a little bit of a interesting time period here because people will assume that on July 1st that everything is done and ready to go, but the state's following the law that the voters voted on, and that time frame doesn't really get a lot of that infrastructure stood up until October 29th.
Was it possible to start implementing this sooner? And could you still implement the card system sooner than that November 18th deadline?
Well, as soon as the ballot measure passed, our agency started working on it, knowing that it passed and that it was going to become law. We also proposed a couple of changes that we thought would be necessary or were worth discussion during legislative session. None of those changes passed, so we fully went forward with the law as it was on the ballot. We could possibly put forward the cards earlier, but the way that this is laid out is a very tight time frame. It's unprecedented for a state to stand up a medical marijuana program, cannabis program this quickly. The only other state that did something kind of like this on this time frame was Oklahoma, and they've had major overhauls of their law because of the flaws that were in it. So our goal is to not repeat mistakes that other states have made, but also make sure we're doing a responsible program that brings relief to those patients that really are looking for relief, but make sure that it's also accountable and that people have the opportunity to use medical cannabis if they're certified, and if they're not certified, that their access is limited.
So you're saying the implementation time frame is July 1st until November 18th?
Well, it becomes law, so IM26 becomes law on July 1st, but what was in that ballot measure laid out the entire time frame for standing up the program. And that program, as laid out and dictated to us, the state to implement by what the voters said, takes several months. And so the vendor program, the certification program, feedback and input by stakeholders, that deadline is October 29th. So that's this time period that I think people are getting confused over. They actually voted for this time frame. This is what they said they wanted. But it is something that the state is following the law, and we're complying with everything that the ballot measure says. And there are portions of it that will leave us in a little bit of a gray area for a while, the way that it's written.
Couldn't you have been doing work in November right away when, the time frame was really November when it was passed through November 18th of the next year, so more than a year to implement the program?
We did. We immediately started. And that is why we started evaluating it, what it meant with 3 different agencies, the Department of Health, Department of Public Safety, Department of Revenue, all working on it. That's how we came up with some proposals during legislative session.